Hi guys, welcome back to Alpha Physio Pelvic Care, all things pelvic health. If you have not subscribed yet to my channel and you're watching me, make sure you press that subscription button so you don't miss a video. And today, in fact, I'm going to divert directly from pelvic health and move up a little bit into the back. However, I don't really like to separate body parts because the whole body functions together. I have had several requests from the moms who are complaining about upper back pain. You know, holding the baby, feeding the baby, taking care of the baby, carrying older children and so on. It really takes a toll on our shoulder. And quite often I also see moms and I hear the actual complaints from them that they feel they're slouching forward. It might be the actual feeling or the posture might be physically present. So they feel like they want something to open up the shoulder and to strengthen the shoulder, to sustain the position and to sustain better posture. I must also add, it's very important not only from the looks and the physical point, but also from the function. The more we're slouching and when we're operating around with our arms in non-optimal shoulder blade position on our thorax here, we're more likely to get shoulder injury, as well as our breathing will be non-optimal because of that collapse of the front wall of the rib cage. So today, you know how I like to make things easy for moms. So today I would like to show you a routine where you don't actually have to lay down. Woohoo! You don't have to get out the mat, and believe me, the on-the-mat routines are great, and of course I will be doing them, but today we'll start with basic, with simple routine on the wall. I'm here between two walls. I will be interchanging myself between this wall and this wall so you can see me from different positions, so you can see what's happening at the back and what's happening from the side. And let's start with simple exercise, I must say, but people quite often don't find it simple when we start to dwell into details. So you find the wall, that there is nothing to disturb you. I had to remove one of my wonderful artworks here, done by my patient. You stand by the wall, and I don't want you to stick to it completely. So if you come with your heels at the end of the wall, you want to make a little step forward so you're slightly leaning on it. We don't want to go too low either, okay? We come straight to the wall, step away. Which part of your body I want you to touch is your sacrum. So this part here, this bone here, area between your shoulder blades, and the back of your skull. Now, I do realize that many of you will have different postures, and for some of you, in order to touch with the back in between the shoulder blades, the sacrum, it might be difficult, or you will feel like you're leaning back, or you feel like you're pushing too much. So try your best to come as close as possible to that position without overstraining the movement. So if you have a little bit head forward posture and you feel like you have to push back and you're almost looking back, don't worry, just come as close as possible and that is fine. And remember, I can make any exercise for you, pelvic floor exercise, even simple thing like shoulder exercises. So here we are, sacrum in between the shoulder blades, back. We're opening our arms. Again, I understand that not everyone will have this range of rotation. My range, in fact, is larger than average. So if you can hold your hands here, it's fine. If you feel like you can't, it's also fine. Don't worry, okay? You can touch with the side of your elbow. Most of the people, including myself, will feel that I'm arching now through my back. I have a bigger arch and my chest is popping forward. So I'm really trying here to touch, popping forward here, I'm arching. What I'm going to do is, I'm going to gently try to flatten out that curve. So as I'm standing against the wall, I'm flattening out that curve, making it smaller. You do not need to close the gap completely, okay? Just flattening it out. You feel that you will have to engage a little bit here, and that's already great. And your chest, your ribs, think about gently dropping them back, down. Now, if you already are a person with a dropped ribs and you're kind of with the sunk ribs, don't worry about that bit. Just try to flatten out the curve, and get yourself as tall as possible. So really, really tall. Our arms are open. And what we are going to do here is we take a nice deep breath into the sides and even into the back. I'm on purpose wearing those crop tops, and I suggest you can wear one as well, so it gives you a feedback. So I'm taking breath into this part. I'm trying to stretch this part here. Breathing in. As I'm breathing out, I'm engaging gently my tummy and my pelvic floor, flattening out that curve under without completely closing it, just gently making it flatter, 50%. And I'm trying to move my arms up, 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 up without them leaving the wall, at least without your elbows leaving the wall. So one more time, breathe in. I did it a lot in front right now. One more time I'll try. Breathe in into the back of my top. That was better. Engage your tummy, gently flatten out the curve. I'm holding my elbows on the wall, on the wall, on the wall, and holding my shoulders away from my ears. I breathe in, I relax. Bring my arms down, and again, engage. If I would stand against the wall here, it would look like this. I'm touching the wall, I'm starting to move, breathing in, I'm flattening out, I'm keeping that engagement, I'm keeping my chest open, I'm moving, moving, moving. Breathing in, I relax. I breathe out, I move. You can repeat this about 8-10 times, but the point here is not to make as many repetitions as possible. You really should feel that there is a tension between your shoulder blades. You are trying here for your lower abs. Your muscles trying to keep that neutral whilst you're moving your shoulder. That's exercise number 1 for you. Let's go now to the second one. I will turn towards this wall first, and then I'll probably move to this one. Okay. We're now stepping away from the wall, quite far away, on a long, outstretched arm distance. Open up those fingers. Don't hold them close. Open, nice and open. Distribute the weight to the max. I'm leaning now on the wall. I'm taking nice deep. Let's double check our posture. If you have a tendency to arch here, gentle tailbone in. If you are like this, tuck your tailbone in. Now, shoulder blades. Think about pushing that wall away. I'm pushing the wall away. I'm pushing the wall away. Okay, I pushed it away to the max. What I don't want to do is this. I'm not rounding my back. I'm just pushing my torso away from the wall. And then I will be coming forward. Okay? Legs parallel. I'm breathing in to prepare. Into the side and the back of my crop top, and I'm breathing out. I'm pushing away, away, away. I'm breathing in, and I'm going with my chest to the wall, bringing my shoulder blades together. Breathe out. I push away, 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 away. Breathe in, together. Notice what my low back is doing. It's doing exactly nothing. It controls itself. Well, I'm controlling it really. So I'm breathing in into my sides. I'm not dropping in here and going back here. There is basically not much movement happening from here to down. I breathe out. I engage here also my pelvic floor, and why not? Breathe in. Notice, guys, the elbows. The elbows stay straight. It's not your wall push-up, okay? We're working your shoulder blades. We're not pushing the wall. We're not doing push-ups. We imagine that we push the wall. Breathe in, drop. Breathe out, push away. Think about sliding your shoulder blades around your chest. Around your chest. Breathe in and breathe out. Again, 8, 10, 12 reps as soon as they're good quality reps. After that exercise, you can straight away go into your rotation. Guys, thorax, this area loves rotation. It keeps us mobile, it keeps our breathing better, keeps our posture better, keep our parasympathetic nervous system, the rested, digested, chill out system more stimulated because it's situated here, all right? So we want that rotation happening. So I did my push and pulls, push aways. I'm going to breathe in again, breathe out, engage my pelvic floor. Pay attention, I'm staying steady at my bottom part. And I'm pulling the imaginary string and focus on the rotation of my chest. You can even get your finger here to give yourself a feedback, yeah, a tactile feedback. Breathe in, I come back, I don't collapse. I hold my legs parallel, I engage my tummy, breathe out, I'm rotating, I'm touching with my finger here. I feel that my pelvis wants to go with me, and it may go about 10%, but I'm trying to resist the rotation as much as possible. Breathe in, breathe out. Long breath so you have time to focus. Breathe in. If you enjoy these exercises, guys, make sure you press that like button. Really keeps me motivated. Breathe in, and you can extend it to full opening. Here, please. Focus on the opening of the chest, not just the arm, okay? We really move arm on the chest, on the chest. Arm is not moving here much, it's the chest, okay? 8, 10 reps on each arm. Nice. Oof, I can feel that, and I didn't even made 8 and 10 reps. Let me show you another one. It's again going to be an exercise slash stretch going into exercise. So again, a combo. I like giving combos. So you don't have to think much, you know, where you're going, where you just do one and then another one kind of naturally follows. I'm turning here with my back first. Triangle here, triangle. I will turn with my side, you'll see it in a bit. Arms and legs parallel here. Drop your shoulder blades away from your ears. Make sure you're not pulling them up. And we're going to bring our arms a little bit higher, more than 90 degrees at the shoulder. Okay, elbows are quite high. And we're going to lean forward, breathe in, and breathe out. Engage. Lean forward, breathe in. And this looks very simple, but I will tell you where is the trick. So you really work your back and not anything else, your mid-back. Now here, the most important, when you go into breath in, this part here, your low back, should stay neutral. At the moment you fall into the arch, you will be going lower and lower and lower, and nothing happens besides the strain in your shoulders. If you really want to kick into that mid-back and give a healthy stretch to the shoulders, we're going to breathe out and almost gently tuck your tailbone in, flatten out slightly the back, and engage your tummy. Keep that area engaged, and you immediately will feel the area here. This is what we are aiming for. Breathe in. Into the sides, breathe out. I'm keeping my back neutral. I'm just hinging from my hips, and I feel that mid-back. Versus this is me just sticking my bottom out, arching my back, not much happening in your shoulders. So one more time, breathe in, breathe out. I'm keeping engaged in my low back. I'm keeping engaged. I'm extending. Sorry, I did the wrong breathing here. Breathe in to prepare. And breathe out to return. Quite often I get asked about the breathing, okay? Honestly, guys, I don't dwell on it. You can be here and you can breathe in and breathe out and give yourself extra extension and tension, and you can breathe in to give yourself more opening. Either way is fine. What I don't want you to do is to hold breath anywhere in those parts, okay? Either way will be correct, as soon as you keep that neutrality. All right? And the last exercise that follows the previous one is again rotation. Rotation forever. So we did our extension, we stay in this position here again. We hold our neutral and we're going to breathe in into our sides. Breathe out. I'm engaging now my pelvic floor. I'm rotating, opening, opening, chest, chest. I'm actively holding my pelvis. I'm actively not letting it do this. Breathe in, breathe out. In, out, in, out, open, open, actively engaging your tummy. So if you repeat these all exercises, it will take you about maybe 15 minutes. You can choose a couple of them. I would always suggest at least incorporate one rotational exercises. I know sometimes they're hard and people find them hard to control their pelvis. Do not look for perfection. We're looking for function. You do it once, twice, 2 weeks, 3 weeks, and after you will see, you will feel much better. If you guys try these exercises, please let me know. How did you feel? If you're a new mom or maybe you don't even have kids, you don't have to have kids to try these. Make sure you hit the subscribe button and the like button. I'm waiting for your comments. I'm waiting for your proposals on more topics you're interested in, and we will see you very, very soon. Ciao, ciao.